The healthcare workforce shortage in America is not a new issue. The COVID-19 global pandemic shone a bright light on the gaps we face. Since February 2020, employment in healthcare is down by 524,000 jobs. Up to 16% of US hospitals have been reporting critical staffing shortages since October of 2021. The physician shortage is also growing. In the next decade, 2 out of every 5 physicians practicing in the United States will be eligible to retire. The Association of American Medical Colleges projects that by 2033, the physician shortage will grow to 124,000. As soon as 2026, the United States will lack an estimated 3.2 million healthcare workers. In rural communities, the healthcare workforce shortage is even greater. Of all physicians eligible to practice in the United States, only 10% choose to do so in a rural community, and yet 14% of America's population lives in those same communities. Up to 70% of the primary care healthcare professional shortage areas, or HPSAs as they're called, can be linked to a rural or partially rural community. In a 2020 report titled "Rural Hospital Closures Threaten Access," the American Hospital Association reported that between 2011 and 2021, 136 rural hospitals closed. Why? Low reimbursement, regulatory barriers, and growing financial challenges as a result of rising costs for labor, drugs, supplies, and needed equipment. The result? People being forced to leave their homes, their own communities, to seek needed healthcare services. Or worse, people choosing to not seek healthcare services at all, creating more issues, more health disparities for those very same communities where they live. The answer to this challenge cannot be doing more with less. The answer to this challenge must be doing more with what we have. Rural hospitals, rural healthcare systems matter. Not only do they provide affordable care close to home, they also serve as economic anchors in the communities where they're found. They support good-paying jobs and infuse spending into the local economy through expenditures on goods and services. In 2020, rural hospitals supported 1 out of every 12 rural jobs, as well as $220 billion in economic activity in rural communities. I am the Senior Vice President and Chief Operating Officer of Yuma Regional Medical Center, a 406-bed sole provider, not-for-profit hospital located in the southwest corner of Arizona. Founded in 1958, today we employ more than 2,500 people, have a medical staff of over 600 physicians and advanced practice professionals. Geographically, we are located 180 miles west of Phoenix, 180 miles east of San Diego, and 22 miles from the international southern border. This geography, this 180-mile radius that surrounds us, is our primary service area. To serve people of this area, we operate an acute care hospital, 32 ambulatory locations, and provide care in 39 different medical specialties. Each year, our emergency department sees over 70,000 people. Our mission is to improve the health and well-being of the individuals, families, and communities we serve through excellence, innovation, and prudent use of resources. Our vision, to be recognized as the model regional medical center. We work together collaboratively to evolve the best healthcare system in our service area. I want to tell you a little bit about our community. Yuma, Arizona itself is a city. We have a population right around 96,000 people. Yuma County, according to the US Census, has a population of around 212,000. 25% of our population are under the age of 17, 55% are between the ages of 18 and 64, and the remaining 20% are over the age of 65. Each year, our population can grow by as much as 100,000 as people from the northern states, the Midwest, and Canada make their way to our community to escape the snow and ice of the winter months. Looking at our community needs assessment, 64% of our population is Hispanic or Latino. 8% of those people over the age of 5 are best described as linguistically isolated, meaning they live in a home where no one over the age of 14 is fully proficient in English. 18% of our population in Yuma County live at or below the federal poverty line. Those over the age of 25, approximately 34,000, have not yet completed a high school education. In 2022, the unemployment rate in our community was 17.2%. People have transportation challenges, and many report food insecurity. So some questions. How do we care for the people of our community against the backdrop of the national healthcare workforce shortage, knowing that while Yuma itself is a city, our community is best described as rural and isolated from urban areas, knowing that so many people face economic issues, have language barriers, and need access to training and educational opportunities. How does Yuma Regional Medical Center make certain that it has the skilled labor force to support its needs as an ever-evolving healthcare system? Who do we need? Do we need people with clinical skills? Do we need people who have technical skills to support advancing medical technology, mechanical systems, and facilities? Do we need community health workers, administrators, support personnel, researchers, data scientists, or perhaps people that we have not yet even imagined as being important for healthcare? And one more question. How does Yuma Regional Medical Center make certain it can continue to deliver needed medical services to the local population, both now and into the future? The bold answer is the development of a comprehensive education ecosystem that invests in the local population through early access to information about diverse healthcare career tracks, including entry-level, mid-level, professional-level development. It means including public and private schools, STEM programs, online learning programs, community colleges, and universities. This ecosystem facilitates training opportunities, including apprenticeships, internships, certificates, degrees, and upskilling. How do we make that happen? Through a new and bold partnership between Yuma Regional Medical Center, our community hospital, and Arizona Western College, our community college. Arizona Western College serves Yuma and La Paz communities with over 170 majors and certificates in a wide range of academic and career and technical programs, as well as non-credit courses in the areas of professional development, customized training, and personal enrichment areas. With 12 different locations and a service area that spans 10,000 square miles, Arizona Western College boasts a diverse educational program, an international program, with representation of students from over 40 different countries. Arizona Western College, or AWC as we like to call it, is exceptionally unique in that it hosts all three of Arizona's state universities on its main campus for face-to-face classes. These partnerships with the University of Arizona, Northern Arizona University, and Arizona State University promote seamless transfer pathways to baccalaureate degrees and beyond in high-demand areas such as healthcare. This effort aligns with AWC's goal of doubling the baccalaureate completion rate in Yuma and La Paz counties by 2035. A little history about what collaboration can do. More than 10 years ago now, our hospital faced a particular challenge in diagnostic imaging. Specifically, we did not have a consistent pipeline of radiological technologists to support our clinical operations. The solution was found in partnership with AWC. Together, we worked to develop curriculum, clinical rotations, as well as access to full-time, good-paying jobs at the end of successful completion of an academic program. The result has been a steady and consistent stream of well-qualified, well-trained radiological technologists to support our operation. We have continued that to this day, and this same approach has been applied in nursing. In the last 5 years, 242 students have traveled down a similar pathway, 193 in nursing, 49 in radiological technology. 2 organizations, 1 mission. 2 organizations serving the same people, the same geography, with a wide range of services to address the diverse education and health needs of our community and to promote workforce development. 2 organizations whose strategic priorities are based on identified community needs. 2 organizations with shared values and a commitment to a philosophy that includes innovation, sustainability, the development of lifelong learners, and reducing healthcare disparities. Together, through a first-of-its-kind partnership, Yuma Regional Medical Center, a community hospital, and Arizona Western College, a community college, working together to develop pathways, create pathways to address education and healthcare needs both now and into the future. This innovative effort invests in the local population, it invests in the local community, and it most definitely is about doing more with what we have. Thank you very much.